YouTubers, it's Chantel. Last time you see me I was doing a before breast reduction video and here's my after. So I went in surgery October 28th, 2013 and I had to be there for 5 a.m. in the morning and I had to fill out all these papers, which took a really long time. So after that we sat there in the waiting room, we waited and eventually I got called down and I had to put on this really unappealing gown. You know what they have at hospitals, and they're not really pretty. Anyway, so I had to wear that and I had to put my clothes in this locker. And then I went in and there was like a whole whack of people because it was a big room filled with like all different patients and they were getting their information taken. So I sat down in this chair and I was sitting there and this woman comes up to me who's doing all my information, like if I was allergic to anything, or somebody who's there just like calm you down, answers all your questions. And then throughout that process while I was doing that, a whole whack of people were coming up and like talking to me and be like, oh hi, I'm so-and-so and I'm gonna be in the room and this is my job in the surgery room. And I was like, okay, because it was like a lot of people. And one of the guys that came and was talking to me, he's like, oh yeah, there's gonna be at least 11 to like 13 people. That's normal for when somebody's having a surgery. I was like, okay. I was like, that's just like, that's a lot of people that I don't really want seeing me down that area. Anyway, so eventually I met with the surgeon who was obviously operating on me. And Dr. Bender Samuel, he came in and he wanted me to stand up straight and he started drawing where he was going to cut me. And I asked him, I was like, why are you doing the anchor one? Why aren't you doing the keyhole one? And he's like, well, the keyhole one doesn't really preserve a whole lot of duct tissues. If you want to breastfeed, it doesn't save those. So apparently the anchor one does. And like I said in my video beforehand, I want to breastfeed, and I was really concerned about that. Anyway, so after that was done, I went back into the waiting room and I was waiting, and then I was waiting for like probably an hour and a half because I didn't go into surgery until 8:30. So two nurses came and got me, a man and a woman, and they walked me down into these big giant doors and it was a great big giant hallway. And I was like looking around, I was like, oh my god, the space, it kind of reminds me of a gym just because they had like certain equipment over in certain size that kind of reminded me of gym equipment. Anyway, but before I went in, they didn't put an IV in my hand. The lady that was actually taking my information, she gave me this cream and she put it all over my hand and numbed it. And here I was like sitting there pinching my hand, like trying to make sure I didn't feel anything. But yeah, I didn't get the IV put in until after I was asleep. So I went in and I saw, and I went into the room, I was like looking around, I was like, holy god, this is like huge. And the weird thing about it was, in my video, I was like my last video, I was very concerned, I was very worried, I was like kind of not wanting to do it anymore. But when I got there, when I was actually on the way there, I wasn't nervous, like in the car driving there, I wasn't nervous. And when I was doing all my information and when they were like walking me down the hall, I wasn't nervous at all. It was really weird because I was actually anticipating me to have anxiety because I have anxiety attacks sometimes. So I was actually thinking, oh god, I'm gonna be nervous, I'm gonna be scared, I'm gonna want to like run out of this room. But no, I wasn't like that at all, but that's what I was expecting myself to be like. So it was really good because I wasn't nervous, I wasn't scared. I think deep down I was happy that this was happening, even though I had no idea what I was going to look like after, you know. But I went on the table and they're like, okay, lay down. They put this blanket thing on me, I guess. And then they started hooking heart monitors or something. They started hooking all these wires to me and it was really weird. I was just like looking around, I was like, okay. I've never been hooked on any machine or wires or anything like that, so it was definitely new. And then they're like, okay, just close your eyes and take a deep breath. And they put this mask over my face to put me to sleep. And I was thinking, okay, people who have had surgery before, they were telling me, oh, they usually do a countdown and you won't make it till 7 because you'll be passed out. And I was like, well, that wasn't the case because they didn't do that. They're just like, okay, take a deep breath. And I was like, okay. And I took in a deep breath and I was like, it was the most disgusting smell. Like, it was so disgusting. The taste was disgusting. The smell was disgusting. I was like midway and like taking a deep breath. I was like, and they're like, okay, take deep breaths. Come on. I was like, oh, I really don't want to. It smells so bad. And they're like, okay. So then I just kept breathing in the gross stuff. Like, thinking about it actually makes me sick to my stomach because it was so bad. Like, it was beyond horrible. Anyway, so I was like, okay, just breathe. So I was breathing and I closed my eyes and the last thing I remember was, okay, Chantel, this is it. And that was it. That was the last thing I remember. I remember seeing like lights. Like, you know, like when you close your eyes and you kind of have like a little different color pattern thing going through your eyeballs because the lights are like right there. Anyway, so it was like, I was like laying there, I guess, and then the next thing I knew it, I woke up in the recovery center, I guess, or whatever they call it. Anyway, and I woke up and I remember because I was like in perfect view, there was like a clock on the side. It was like one of those big giant school clocks, or anyway, and it said 11:37. I was like, what? Because I was all hyped up on drugs. Like I was on drugs the whole time. And anyway, they put me on this drug called Dilaudid or something for pain. Anyway, and I remember waking up and I saw the clock and I was like looking around. I had no idea where I was. And I was like crying and I was like bawling my eyes out and the nurse was like, it's okay, calm down, it's fine. I was just crying, I was just like a wreck. And the whole time before I went into surgery, because it was only supposed to be a day surgery, so that means like I was supposed to go in this the same day and leave the same day, like stay in the hospital and recovery for a few hours, but I had such a bad reaction, so by law they had to keep me there, so I had to stay overnight. And I've never stayed overnight in a hospital ever. Anyway, and the nurse was just like, oh, just calm down. And she kept putting more drugs in my IV, so that kept knocking me out, because like my body's completely like a virgin when it comes to drugs. Like I can take children's Tylenol or Advil and I'll be like knocked out, like one little pill and I'll be knocked out and I'll be like all looped out of my mind because I don't take pills or drugs or anything. Like I'm clean like that. So my body was completely reacting all these different ways and I kept waking up and crying, and every time I woke up there was like a different nurse, because the first nurse was really nice, but I guess she went on lunch or something, and then they kept bringing in other people to keep putting drugs in my IV bag. And I was just like, and I was just crying. I was like a big baby. Anyway, and I was like, I want my mom. And they had to go find my mom out in the waiting room. And she came and she sat with me. I have no idea how long I was in recovery for, but I was in there for a long time. And eventually they're just like, okay, yeah, you can't leave. So like I was awake and I was like trying to lift my head. Like I was laying on the bed, I was just like trying to lift it just to see around me. And I don't know if you've ever been on a Gravitron, like it's something that they have at a fair, and it's like a space shuttle or something, and it literally, the gravity pushes you back, like you can't move at all. Like that's what it felt like trying to lift my head up. I was like lifting it up and I was so dizzy. I was like, and I couldn't lift my head up. And it was so bad. Anyway, so then they wheeled me off to the room, which I really don't remember being wheeled to a room, but I remember waking up in my hospital room and I was like, oh yeah, I got the room to myself. And then I guess I passed out and I woke up and I had like the, oh, what's it called? The wall thingy, the sheet wall. I don't know what it's called, I forget. Anyway, and there was somebody else on the other side. I was like, damn, I don't get a whole room to myself. But my mom had to stay the night with me. And my dad left us there and he went back home. Rude. Anyway, and they kept giving me drugs in my IV bag, but eventually they stopped doing that. And then they just start stabbing the back of my arm with a needle. And I hate needles, so that really hurt, because they would do that periodically throughout the night. And they would also have this woman in who would check my temperature and whatnot. And they would keep doing that all night. So like maybe every hour. So I didn't really sleep that much, even though the pills kept knocking me out and whatnot. But It was so hot in that room. Like, I remember I was in the room and I was just like, holy God, I'm gonna die in here. Not because of pain, I'm gonna die because of the heat. Anyway, so I asked her for a fan, and throughout the whole night, like, obviously I had to go to the washroom and whatnot, and like, I was hooked up to the IV, so I had to bring this big metal thingy with an IV bag hanging from it, and I had to get a nurse and my mom to help me. And every time I got up, because the drugs made me so sick, like so nauseous, I threw up every time. So I couldn't even take a sip of water because I would throw that up too. Like, I couldn't have anything, and I wasn't allowed to eat from 12 o'clock and on before I had surgery, like 12 o'clock at night. Anyway, so I was starving, and like the whole time, like before I was in surgery, I was thinking, oh yeah, I'm gonna leave here and I'm gonna go to Burger King or something, or Subway, and get something to eat. And I was like, yeah, that's not happening. And so I was still sitting there in the bed, dying of heat, and I finally got a fan. And every time I had to, you know, go to the washroom, I would throw up, which really sucked. Anyway, it was morning time, it was like 6 something. And I remember waking up, and it was so weird, because I remember waking up and there were like a whole whack of people standing at the end of my bed with little clipboards, and they were writing things down. I was like, whoa. And then one of the nurses that I remember from the day before, he came in, he was like, oh, I'm just coming to look, and I had a wrap, you know, like if you had like a sprained ankle or something, you know, you just wrap it up in something. Anyway, that's what I had around me to hold everything, I guess, in place. Anyways, so he was like pulling it down, and I was still drugged out, and I was like trying to like look because I wanted to see what they looked like. And oh God, it was so bad. I was looking, I was like, oh my God, they look like purple little raisins. I was like to Mom, I have no nipples. Like, I was so high up on drugs, I thought I had no nipples at all, because everything was purple because it was so bruised. And plus they had little pieces of tape going around the incisions, so I couldn't really see a whole lot of things. I was like, my areola's gone and I have no nipples and I'm all purple, and I was just freaking out. And they're just like looking, and then he was like feeling my nipple, and I was like, ow, and stuff. Like, it was really sensitive. He's like, oh my God, you totally jumped when you were in surgery. I was like, what? I was like, did something get cut that wasn't supposed to be? Because apparently I had jumped, like, even though I was asleep, I was so sensitive that it made me physically jump while on the operating table. I was like freaking out then. I was like, you couldn't have kept that to yourself. I didn't want to know that. I was like, I just wanted to know everything went okay, which apparently it did, but I jumped, and I was like, I was nervous. So, throughout the day that I was there, because I left around like 1 or, no, not 1, maybe like 12, and the nurse, they were trying to get me to eat something, and I couldn't eat anything because I kept throwing it up. So they wanted to make sure that I could take my drugs before I left, so they put in this like little cup thingy, and they filled it with like apple juice, and they crushed up all the pills because I can't swallow pills. Like, I have bad gag reflexes, gag reflexes, anyway, and I can't swallow pills at all, so I can't take them. Anyway, so they had to crush them up because they didn't come in liquid, so they had to crush it up, and I could take that, like I could actually hold that down long enough, but I couldn't eat anything. So they're like, oh, okay, yeah, that's great. Anyway, my dad came and picked me up, and they put me in a wheelchair after I was getting dressed, because I had to get dressed, obviously. I wasn't going to leave the hospital in this ugly, repulsive gown. Like, come on. Anyway, so they were pushing me out, and I had to wait for my dad to pull around the car from the underground parking thing. Anyway, so I got in. It was so painful. Like, I couldn't wear a seatbelt. So that was good. So I was driving, like, because we live in the valley, and obviously the hospital's in the city, so it was like an hour some drive. Anyway, we got there and we had to go to the drugstore, and I haven't eaten for hours, like, at all. Anyway, like, and so we got to the pharmacy back home, and I was feeling so ride there. Anyway, and when we finally got there, my mom went in and get the prescription, and I was sitting out in the car and I was like, oh, I'm gonna be sick. And I threw up. I threw up in the car, and there was nothing there for me to throw up in, so I had to use this old coffee cup. Not one of my finest moments. Like, it was so bad. Like, I was like literally car sick, I guess. Anyway, so I finally got home and I just crashed. I just went to bed. And that's kind of what it was. And I remember I'd wake up crying, and my mom would always have to get me like pills and stuff and crush them up, and then I'd be back to sleep. My mom had a great old time because I was looped out of my mind. I was like, I wasn't talking any sense at all, and she would just laugh at me the whole time. After I got home, we tried to like set up my bed, and we had like pillows because I had to sleep on my back. I had to be elevated the whole time. And my bed wasn't big enough, so I had to sleep in my mom's room because her bed was big enough, and like everything felt more comfortable in her bed. So I had to sleep in her bed and she had to sleep in mine. It was like a little switcheroo. Anyway, and it was very uncomfortable sleeping because I can't sleep on my back. Like, I sleep in the fetal position. Like, I sleep curled up on the side and I move around, and you know, like, it was so difficult, and I just had a really hard time sleeping. It was definitely not fun. Anyway, it was about like a week or so that I had surgery and whatnot, and I remember going in for my first shower. Like, I was so scared to shower and whatnot, and I had to take, because I had the bandage on, so it was like almost like it was sewed together. Like, my mom literally had to take scissors and like cut the back of it just to get it off of me. Anyway, so we did that, and then I was getting in, I was like, you know, I was getting undressed, the water was going, like, obviously. Anyway, and I just remember staring in the mirror, and I was just like, and I literally started crying my eyes out. They looked so small. Like, it was like, it was very sad. Like, and remember, I'm still hyped up on drugs, so I was so like overreacted. Like, and I had little tape, you know, I had tape around the incisions, and I had to keep those tape things on for like 2 weeks. Anyway, and everything was still like purple, and I was like looking around, and I like looked at my shoulders, and it had all this like purple stuff, you know, if you have like a purple popsicle and it melts and it gets all purple and whatnot. That's what it looked like, and I was like freaking out. I was like, oh my god, what is this? And I was like, oh god, I bruised all the way to my shoulders. I was freaking out, but no, it was just like the stuff that they put on me or something, like disinfectant or something. Although it was purple, which was really weird. Anyway, so I got in, and I was like, okay, because it was like very intense. Like, I was having a panic attack because I felt like everything was ripping. So I was like freaking out because like I had the wrap on to keep everything in place, and now that I had it off, I felt like everything was falling apart. My stitches were ripping, and I was like crying in the tub. I was just like crying. I was just like, my boobs are so small, and I'm never gonna have my big boobs ever again. And I was overreacting the whole time. Anyway, and it kind of hurt a little bit just with the pounding of the water and the pressure, but I wasn't allowed to get any soap in it, so I was like thinking, well, how am I gonna wash my hair? How am I gonna, like, you know, wash under my armpits and all this stuff? And I was like freaking out because I didn't want to get them infected, like, you know, that would be really bad. Anyway, so I was just like, oh, I hated shower time. For almost a month, I hated shower time of waiting for it to heal long enough. Like, I hated it. I tried to avoid it as much because I hated it. And I never knew how much muscles were connected, like, just to move my arms, like, you know, like this, and just to sit up. It was the most painful thing ever. Like, it pulled and it hurt. Like, I literally had to get my mom to, like, pick me up, like, you know, like, help push me up out of bed and help me actually stand up. Like, it was bad. I was like a total gimp, and it was bad. So I couldn't do anything without my mom because I'd be too much in pain. Like, I couldn't move, I couldn't do anything. Anyway, so yeah, when I got back and I had to get my mom to help me with certain things, obviously. And I just remember I was just like, Mom, I have no boobs, I have little girl boobs, like, because what I had were E's, or was it F's? Oh god, I don't remember. One or the other, it was one or the other. Like, I had big boobs with a really small waist. Like, I was like, you know, like, boom, boom. Yeah, anyway. And I was just like thinking, oh my god, most girls spend their life wishing they had boobs like mine, and now I'm gonna be one of them saying, what the hell was I thinking? I'm gonna regret this. And I was freaking out, and I was like, I'm gonna spend the rest of my life wishing I had my boobs, and now I'm not gonna be happy. And I was just over dramatic. And but everything worked out fine. A month later, which would have been November 28th, I took pictures and whatnot, and it's been 2 months now and a few days, or a few weeks actually, since I've had surgery, and I'm very pleased with it now. I've lost a lot of weight since it. I lost like 9 pounds since the surgery, and I'm really happy, and it's something that you should really look into if you really want to get it done. So like I was saying, I'm really happy with the outcome. I really didn't think that I would be. Right now I'm using bio oil, and it's just to, you know, you gotta keep them moist and whatnot, like the stitches, and obviously it's supposed to help take away the look of scars a little bit or whatnot, and that's basically what I'm doing. My clothes fit a little bit more. I can see my stomach over. I can see my stomach again, which I never could able to ever before, but some clothes are baggier in the area now because they were stretched out for so long, and now they kind of look baggy on me. Clothes fit me better. I can't wear a bra yet. I'm still wearing a sports bra just because I can't wear a bra because of where the wires come under. It chafes and it cuts into it, and it really hurts. So I'm stuck wearing a sports bra, which is fine. I'm really excited that I can start wearing cute clothes and cute bras, and I can wear all that, and cute bikinis, you know. I'm looking forward to that, even though I can't do that right now. But it's something to definitely look forward to, and if you're really considering getting it done, you should really look into it. You should really do your research about it. Make sure you qualify for everything, and talk to your doctor about it. Get a referral or whatnot, or contact them yourself. It's definitely, I wouldn't say life-changing. It does make you feel better about yourself because they're no longer the main focus anymore. Like, you are the main focus, like, completely. Like, it's not them anymore, it's you. And I really like that because, you know, you get bad attention and whatnot from it. And, like, I'm really grateful and really happy that I got the opportunity to have it done as well. It's definitely gonna take a long time for healing. I don't really know exactly what the healing process is, but it's gonna be months. I know that part. It's gonna be months, but so like I said, if you really want it done, then you should really consider it. My back, it feels better. It feels a lot better actually. And it's weird because now I can sleep better too. Like, I'm not laying on them anymore, and they're not getting underneath my arm, and like, I'm learning how to move around more, and it's really weird. It's like learning how to walk when you're a baby. It's weird. It's like a learning process. You gotta learn like how to move your arms now because, you know, you develop this way to move around yourself because you have to, and just to like be functional and mobile and whatnot. So I'm learning all these different things that I never could do before, like, because they always got in the way of everything. And I can actually do sports now. I can run and it won't hurt, and they won't be all up in my face and everything. And, you know, it's great because now I can do things that I love, and I can feel confident about myself. And I guess that's really what the whole process is. It's a transformation, not only on the outside, but on the inside. So if you really want it done, you should get it done. Anyway, that is my story. I might have some follow-ups later on just to see how I'm doing and what I look like and whatnot. I'm not sure. I might. Anyway, peace and love. Thanks for watching.